Thank you, everyone. It's the last talk of the day. I make sure I make it fast and entertaining. My name is Khazaeizadeh. I'm a primary care physician. I'm internist. Also co-founder of the company called sick.org. And the reason actually we came with this name was we thought in this country we don't have healthcare. And we have a sick care, so when you're sick, you go to the doctor. So we have this app called Sick App. So when you're sick, you don't need to think what app should you go. You just go to the Sick App, and you actually click on the bottom to be seen for whatever reason you want to see. But here I want to focus on what's your health philosophy and why that matters so much. Actually, it's your health philosophy is the #1 predictor of success when it comes to your health. So every decision you make today, you can actually pass on the better gene, to the next generation. Couple of things I wanted to discuss here. So you probably learned something when you leave here, and how we die at the chromosome level. And also, what is the gene expression, and what is the telomere? If you know what is the chromosome, we have 46 chromosomes. Half of that come from your mom, half of that come from your dad. And when I went to medical school, we all thought, we're doing with whatever chromosome we get from your mom and dad. But we learned in the last, 10 years, a group of scientists came with this idea of gene expression, and it is if you do all the good things, you can bring to the surface all the good genes, and if you do the bad things, all the bad come to the surface. The way we die at the chromosome level, it's the shortening of your telomere. Any chromosome has this telomere at the end that as we age, the telomere becomes shorter, and we die. So it's if I want to tell you, it's like the shoelace we have is a plastic at the end of the shoelace. If the plastic becomes shorter, what happened? Your shoelace become unravel, and you have to throw it away. It's the same thing happened to our human body, right? So, is there anything we can do to make that telomere longer, or we can reduce the speed of the shortening of the telomere? Yes, we can. All the good things, I'm going to explain that. And as I said, on top of each chromosome, we have 1,000 genes. So if you do all the good genes, you can bring up the surface all the 500 good ones. If you do the bad things, all the bad genes going to come to the surface, and you can actually pass it to the next generation. So, if we know what to eat, how much to eat, what toxin to avoid, if we know how much to exercise, if we know when to exercise, if we know how to manage our stress, and if we know how to have a better relationship and have a good time sleeping, these are the things you can do to actually, elongate your telomere. If anybody knows Dr. Dean Ornish, so this is the research for Dr. Dean Ornish. 25 years of research showed if we do all of those, and I'm going to explain how we can do that, we can actually elongate the telomere by 15 to 20% in 6 months if we do all the good things. Eat well means what? Means you move from animal-based protein to plant-based protein. I'm not saying completely go, vegetarian. You can choose 1 or 2 days a week, just not to eat animal-based protein. The second one, move more. Means exercise, right? Exercise every day. Anybody, can you show me a hand? Who exercise every day, every single day? Perfect. 3, 4, 5 people, right? Who 5, 6? But who brush every day? Who brush teeth every day? Every day, every single, right? So that's the same logic. The reason you brush every day is what? Because of your, right? The same reason you need to exercise every day, half an hour. If you can't go to the gym, I'll take half an hour walk. Just half an hour walk is better than nothing, right? Stress less. I'm not saying don't have stress. I'm saying manage your stress. How most people manage their stress? How most people manage their stress is they don't actually, right? So they eat more, alcohol, drug, right? So that's how most people their stress. But the way you're supposed to manage your stress is meditation, relaxation, exercise, yoga, I don't know, see your therapist, right? One of the best way to manage your stress if you don't know how to do it. And love more. If you have a better relationship, you make all better decisions in your life. If you have a bad relationship in your life, so you make all those bad decisions. So you better have a better relationship or learn to have a better relationship with people around you, including your loved one. Sleep well. And other things can actually, and it's different for people from 5 hours to 8 hours for different people. But if you follow all those 5, you can actually stay healthier and longer. And I bet you in 10 years, we're going to have cure for majority of the diseases we know. But if you just stay stay healthier for the next 10 years, so you can actually stay healthier way longer. So you have a choice and you have a decision to make. So you make a better decision today and one tomorrow, right? Because with the better decision, you can pass the better gene, down the road. But can your health philosophy hurt you? The answer is yes. But also it can hurt you and your family and your community, and also it can hurt the next generation. Our healthcare system design and focus on treating diseases and sick care. The truth is our healthcare system designed around 1900, and that was the time we had a lot of pneumonia and the flu and a lot of injured people. So the way we have to deliver the vaccine and antibiotic and other care was the doctors and nurses we had back then. So, but we are living in a different world, and we can do much better. But is there a different road or something different we can do? Absolutely. I mean, in United States, we have the best sick care in the world, right? So, but we need to focus on something else, well care. That's something that, as a primary care physician, if I can just teach my patient, just those 4 or 5 things, right? And it's a simple stuff, no-brainer. The problem is no-brainer is not, known for people. So, what insider know about our healthcare system that the rest of us need to learn? There was an article in Time magazine a while ago. So they interviewed a lot of physicians in the hospital, and the question was, what scares you the most? Anybody knows what's the answer? Being a patient. Being a patient scares us the most because we know what's going on in the hospital. So, really, in order to stay healthy, do we need health insurance? We really don't need health insurance to stay healthy, right? To stay healthy, all you need to do, those 4 or 5 things that we mentioned. Health insurance is I'm not sure what type of name is that, but technically it's a sick insurance, because when you're sick, you want to go to see a doctor, right? So the greatest doctor in the world lives right inside you. Your body is extremely intelligent, and your body knows how to heal. So, most of my patients come and they have a bunch of, vitamins, multivitamins they're taking for no good reason, and they ask me, so which one is good? I mean, my answer is none of them. If you can eat fruit and vegetable and variety of the food, so you don't need really multivitamins, unless some of your vitamins, when we measure, is low, then we might, replace your vitamin D maybe, or B12, and that's all we need. But the rest, really, you don't need to take multivitamin for healthy people. So USA has the best sick care system in the world. We have the best doctors, the best nurses, hospitals, academic health centers, the best health education, drug, and we are leader in the research. But our healthcare delivery system is one of the worst among the first world countries. Some argue that, it's personal responsibility to, avoid preventive diseases like diabetes or high blood pressure or obesity. So I'm all for personal responsibility. I guess no one can argue that. But also, I believe in government responsibility. I mean, advertising for junk food in the last 2-3 years was, to the roof. And I guess government need to provide some information to people and some regulation to avoid that type of advertising. The way it goes, if you look at the cost of healthcare, is $4 trillion. The whole GDP of United States is 23. Means 18%, 18% of the whole money of the whole economy, United States economy, goes to the healthcare, and half of that is waste. And from the other half, 80% go to treat of the chronic diseases like diabetes, hypertension, obesity, high blood pressure. So those are the things we can avoid with just lifestyle modification. So the question is, can we prescribe, as a primary care physician, can we prescribe a lifestyle medication as a prescription? And the answer is yes. And recently, Medicare started paying for that. And that was, all help of Dr. Ornish that pushed through that, research for 25 years. Dr. Ornish was actually a cardiologist, and he was the cardiologist of President Clinton. And when President Clinton had heart attack and they put a stent, started like eating burger, right after that, and 6 months, 7 months after that, he had another episode of blockage in the heart. So after Dr. Ornish sort of taught him to eat better, sort of everything got resolved. And since then, he had no other heart attack. So changing the system requires recognition of a few things. One is the culture. Again, can we do more telemedicine, or can we do transfer the point of care from doctor's office to the people home, or can we do some data donation? Yes. The technology, how the technology can actually improve the healthcare. And why so far healthcare industry is not disrupted the way, for example, transportation or housing disrupted. If you look at the Uber is a communication platform, so simple. People can go into it and they can navigate without any training, right? So it's a lightweight software. So eventually, a lightweight software that has all the patient information and is patient-centric, not insurance-centric, not hospital-centric, not doctor-centric. Eventually, that type of technology can disrupt the healthcare. So if somebody wanted to disrupt the healthcare, you can reverse engineer that type of technology. Better medical education. We need to focus on prevention than treating diseases. Better health policy. Regarding reducing some of those regulations, so we can actually move toward better prevention. Better reimbursement system. Half of the time that we see the patient, we barely get paid for it. And also communication. We actually at the sick organization. We're committed to do whatever it takes to disrupt the healthcare, in a good way. And at SIT organization, we have this unique position to be able to help our patient and our community. So let's build a system for well care, and let's make that system available to everyone with the help of technology and innovation. Thank you, everyone, for listening. Thank you, and I have 8 minutes for questions, so go ahead.
So I have 2 questions. My name is Reginald Mbarke. I'm in the telehealth field, mobile health technology field. I take a lot of vitamins. And, I'm in my mid-40s. I take ginger, turmeric, those little garlic pills, zinc, obviously COVID, and vitamin D. And sometimes I mix those 2 with the multivite, right? So you're saying that's not necessary in my mid-40s, that I should be trying to eat garlic every day, trying to find something with turmeric in it, or trying to find something with ginger in it, or, that's question number 1. Question number 2 is, you talk about Uber and disrupting healthcare in a good way, the way Uber, and in a simple way. Any idea of an example of what that could be?
Sure. Thank you. So the first one, I do evidence-based medicine, and I have to go with those, evidence that we have. There's an article in New England Journal of Medicine, and next year went to Cleveland Clinic Journal of Medicine. The question was, is that okay for healthy people to take vitamins? The answer was no. And then, why not? Because it might hurt you, right? So do we have any double-blind random study to see if all of these multivitamin that we're taking, it's helping you or hurting you? We don't, right? And I'm not sure if you know about the Framingham study. 100,000 population, we put them on high-dose vitamin E, and this was a while ago, 20 years ago. So we thought 2 things can help women. One is high-dose vitamin E, and 2 was hormone replacement therapy. And this was 100,000 population in the city of Framingham, north of New York. And after 10 years, what we learned was those people, we gave them higher dose of vitamin E, they actually had more cancer and had more heart attack. So we have to call all of those patients that we put them on a high dose and ask them to, don't take your vitamin E. So we burden once in that study, Framingham study. So everything you do, you need to know what is this risk, what is the benefit, right? So in this case, I guess the risk was way more. And the absorption of the multivitamin is less than 1%. So you put your kidney and the liver in more work to metabolize all of those chemicals and get rid of 99.8% of that in order to absorb 0.2%. That's not healthy. And the second one, you said how technology can improve. Something called Uberification of the healthcare, or democratization of the healthcare, right? So how can we make a visit almost free or accessible to people? I mean, almost everybody has a smartphone, right? So what we started doing at our own organization was, so come and see us through our platform. So if you have insurance, we'll take it. If you have insurance, we don't accept it, we'll still take it, we just charge you copay. If you have no insurance and government pay for it, like a CARE Act for COVID related, we'll take it. And if you have no insurance, and if government not paying for that, we still take you. We give you 2 free visits to see us, right? So even if you have a copay of $20 or $30, we might be able to help you through that copay and see you and take care of your problem right now. The reason most people don't go to see their own physician, even they have insurance, is because some people have high deductible and a copay, so they're not sure. If you go to the doctor, so they have to pay $200, $300 down the road. But if I educate my patient that for annual physical, even your deductible is $10,000, it doesn't go through deductible, right? If I see you for screening for depression, screening for obesity, screening for high blood pressure, still it's going to be a free visit. So how can I do more of that free visit to my patient in order to prevent things, right? So.
I have a question regarding prevention, which I subscribe a lot to, and I commend you for actually talking about that. But let's look at the real world, especially in the United States. You know, we have, I think, 45% people obese, and yet the education now is actually trending towards not criticizing obese people. And regarding that as a sort of discrimination, and it's actually now integrated into the culture as being obese is not being wrong and not being ugly, it's actually nice, acceptable, and so on. So what do you think about that?
So yes, in the last 60 years, so the rate of obesity went up from 15% to today is 75%. So 75% of the country is overweight or obese, right? And it's a disease, has an ICD-10 attached to it. And then when it become morbid obese, actually it's going to be the more problem, because then you're gonna put you on more risk of heart attack, stroke, and other stuff. I guess our dentist colleague, they did a much better job, because everybody at least, brush once or twice a week, but not everybody exercise once or twice, a week. So how can we actually help our patient to lose more weight? Is to education, right? But the reimbursement system is I get paid for visit. I don't get paid for performance, right? So if I don't do anything, if my patient being more obese, and I don't do anything, at some point they have diabetes, high blood pressure, cholesterol, and then I can see them once every 3 months, and that's how I get paid. That's unfortunate, but that's the way it is. Need to be changed. Yes, sir. I have 1 more minute.
Yeah, I'm Dr. Shintani from Hawaii. I started our integrative medicine clinic at our medical school. My question is this, in dealing with our healthcare system, one of the problems is the cost, and the elephant in the room is how the drug companies are really escalating the costs. For example, you talk about obesity. They just recently approved a drug for obesity, but when you find out what it costs, it's $1,600 a month, and the copay is still, now actually insurance won't cover it. So how do we deal with the escalating costs of medication? Even insulin is unaffordable for some people, and they need it for life.
I guess to stay healthy, you don't need medication. In order to lose weight, you better eat enough not to die. Small portion. Our brain designed to eat way more, evolutionary. We're not hungry, but we keep eating extra 30 minutes because our brain, designed for...
But some people need medication, like insulin, for example. If you have type 1 diabetes, no amount of dieting is going to prevent the need for things like insulin. Or if you have cancer, for example, there are many cancer drugs. What do you do about that? Because that's To me, that's what's breaking the bank in terms of our healthcare system. And then you can't pay the doctors because you're paying the drug companies.
I have no solution for that. I guess, it's a work in progress. Can I bring the cost of, medicine lower? Somehow, yes, I can, through GoodRx or some other, organization, but I have no solution for that. Thank you, everyone. I guess this is my time, and thanks to everybody for listening.